Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Bedwetting. Introduction. Many children wet the bed until they are 5 years old or even older. This can sometimes be explained by the fact that a child's bladder is too small or that the amount of urine produced overnight can exceed the bladder's capacity. Children do not wet the bed on purpose and most outgrow it. Until then, bedwetting alarms, bladder training, and medicines might help. This program will help you understand why your child wets the bed. It also reviews some ways that you can help your child stay dry. It also suggests when to take your child to see a healthcare provider for his or her bedwetting. Causes. In most cases of childhood bedwetting, the cause is physical and not the child's fault. Bedwetting should be considered a medical problem and not a behavioral problem. Some of the most common reasons for wetting the bed have already been mentioned. They include small bladder, deep sleeper, lack of bladder control. Bedwetting may run in the family. If both parents wet the bed as children, their child may have the same problem. If only one parent wet the bed, the child has about a 50-50 chance of having the problem. Some children wet the bed even if neither parent ever did. Bedwetting may be caused by an infection or a neurologic disease. Children with neurologic diseases may also have daytime wetting. A child who has been dry for several months or even years may return to wetting the bed. The cause might be emotional stress, such as loss of a loved one, problems at school, or a new sibling. Potty training too early may cause a child to wet again. Tips for staying dry. Try skipping drinks before bedtime. Avoid drinks with caffeine, like soda or tea. These drinks speed up urine production. Give your child one drink with dinner. Explain that it will be the last drink before going to bed. Make sure your child uses the bathroom just before bed. Your child may feel bad about wetting the bed. Let your child know he or she isn't to blame. Be supportive. Praise your child for dry nights. Even if all of the tips to stay dry are followed, the child may still wet the bed, but these steps are a place to start. Be patient. Most children grow out of bedwetting. Some children just take more time than others.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
When to see a healthcare provider. If your child is younger than 5, don't worry about bedwetting. Many children do not stay dry at night until age 7. Most children outgrow wetting the bed. A single episode of bedwetting should not cause alarm even in an older child. If bedwetting continues between the age of 5 and 7 and the bedwetting accidents happen during the day as well as at night, your child should see a healthcare provider. If your child is 7 years old or older and wets the bed more than 2 or 3 times in a week, a healthcare provider may be able to help. The healthcare provider will ask questions about your child's health and the wetting problem. Your child will likely be asked for a urine sample. A healthcare provider uses the sample to look for signs of infection. By testing the reflexes in the child's legs and feet, the healthcare provider can check for nerve damage. Sometimes bedwetting is a sign of diabetes, a condition that can cause frequent urination. If your child has an infection, a healthcare provider can prescribe medicine. In most cases, healthcare providers find that the child is normal and healthy. If your child is healthy, a variety of ways are available to help your child stop wetting the bed. Treatment. There are several ways to help children who have problems controlling their bladder. Let your child help decide which ones to try. Bladder training can help your child hold urine longer. Write down what times your child urinates during the day. Then figure out the amount of time between trips to the bathroom. After a day or two, have your child try to wait an extra 15 minutes before using the bathroom. If your child usually goes to the bathroom at 3:30 p.m., have him wait until 3:45. Slowly increase the wait time. This method is designed for children with small bladders. It helps stretch the bladder to hold more urine. Be patient. Bladder training can take several weeks or even months. A small moisture alarm can be put in the child's bed or underwear. The alarm triggers a bell or buzzer with the first drops of urine. Your child can then stop the flow of urine, get up, and use the bathroom. Waking up also teaches the child how a full bladder feels. Medicines are available for treating bedwetting. Talk to your healthcare provider to find out more about medicines that might help. Bedwetting may return when the child stops taking the medicine. If this happens, keeping the child on medicine for a longer time helps.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Many children wet the bed until they are 5 years old or even older. Most children outgrow wetting the bed. A single episode of bedwetting should not cause alarm even in an older child. Children do not wet the bed on purpose, and most outgrow it. In most cases of childhood bedwetting, the cause is physical and not the child's fault. Bedwetting should be considered a medical problem and not a behavioral problem. Some of the most common reasons for wetting the bed have already been mentioned. They include small bladder, deep sleeper, lack of bladder control. Try skipping drinks before bedtime. Avoid drinks with caffeine, like soda or tea. These drinks speed up urine production. Make sure your child uses the bathroom just before bed. Most children grow out of bedwetting naturally. If your child is 7 or older and wets the bed more than 2 or 3 times a week, a healthcare provider may be able to help. There are several ways to help children who have problems controlling their bladder, such as bladder training, medicines, small moisture alarm. Thank you for using Explain.